And I told him to give me some drugs, put me on a plane, send me back to America. His advice to me was that wasn't the best plan. I figured it would be a couple-week delay, and I told him I didn't have time to stay in India for 2 weeks. And he said, "We can do it tomorrow." I really like that. My name is Mike Kimble. I'm a 74-year-old American. After 25 years in the U.S. military and 25 years in worldwide business, I have traveled everywhere. I have been in many hospitals, and I have had many injuries, and I've been sick as many times as you can think a 74-year-old man would be sick. In October of 22, I had a bulging disc which hit and caused a sciatic nerve injury and caused both of my legs to go bad, and I was in a wheelchair in America for 2 months, waiting for help, mainly because of COVID. And I was on heavy drugs and steroids, and they wanted to fuse my back. The wait was so long that my back healed on its own. So that was a year and a half ago. This time, 3rd of May, I found myself in a small village in India, and it happened again. I could not walk, I could not move, and I was in great pain. My partners placed me in our vehicle, and we drove towards Hyderabad. During the 6-hour ride from the village to Hyderabad, my partners explained to me that Hyderabad had become a medical tourism center, and there was medical care here for every type of medical need. And in fact, there was a brand new hospital, Arete Hospital, that specialized in my problem.
This is about a 72-year-old gentleman who came to us with the chief complaint of pain in the lower back with significant pain radiating to his left lower limb. He has a left thigh pain because of which he was not able to walk. The pain was since many years, almost 2 to 3 years, but from last 3 days he had significant pain in his left thigh because of which he was not able to walk, and the pain is so debilitating.
It was Dr. VRK that convinced me to have this procedure. He's a renowned surgeon, practiced in Japan for many years, has many accolades, and I told him to give me some drugs, put me on a plane, send me back to America. His advice to me was that wasn't the best plan, that I should simply allow them to do the MRIs, to study what my problem was, and see if they could have a better solution.
And on examination and further investigation, we found to have a L5-S1 massive disc prolapse, which was compressing his left nerve root, because of which the symptoms are there. So we have suggested him surgery and planned with the conservative management in India. If he is comfortable, we thought of sending back to US.
His philosophy was very sound, that it's a simple procedure, it can certainly be done. They do 2 or 3 a day, and why in the world would I want to put myself on an airplane for 24 hours and risk being in great pain? I also looked on his wall, which was just covered with accolades, some gold award from Japan where he had studied, and I knew I was in good hands.
So we have planned for L5-S1 minimally invasive spine surgery, where we have done a small incision and removed the disc which was compressing the nerve root and freed the nerve root, which is the reason for his radicular pain.
I figured it would be a couple-week delay, and I told him I didn't have time to stay in India for 2 weeks. And he said, "We can do it tomorrow." I really like that. So the next thing I did was I called my family, my wife, my children. They all agreed, do it now. And I agreed to be admitted into this hospital. And all my medical checks were done, and I was prepared for surgery the next morning. He told me the doctor, Ravish, who would do my surgery, was exceptionally qualified and had done many. And he has seen me 2 times a day, every day since I've been here, and he has released me today. And I have just been in the best of care, and I thank them both.
This patient is a typical example how patients suffer in silence for almost years. Our patient has been having back pain and was unable to sleep flat on his bed for almost 2 years, and he has been avoiding surgery for various reasons. Minimal invasive surgery is a modern way of dealing with spine disorders like slip disc or listhesis. This helps patients go back to their normal life within no time.
But the best part is that after surgery, 2 hours of surgery and 2 hours of recovery. 4 hours later, I woke up with zero pain. I could lay on my back, I could move my legs. I was normal, and I was incredibly pleased.
Post-operatively, the patient was comfortable and he was mobilized on first post-operative day. He was able to lie down and walk comfortably, and now that he's walking independently, he's ready to go back to his country.
On post-op day 1, when I visited him in his room, he was delighted to share his experience that he had a very sound sleep after many years. This is a typical example how minimal invasive surgery can be really helpful and help you recover and get back to your normal life immediately without any delayed post-operative complications.
So today I finished my 3 days of observation, and I will get on a plane tonight and take a 24-hour flight back to Seattle, Washington, and I'll be home. But it was important for me to tell how great this hospital has been to me. So from the senior doctors to their assistants, to the mid-grade managers, the cleaning staff, the dietitian has tried to make me fat. It's the best food I've ever had in a hospital. So everything here for me has been wonderful, and I'll give the specific reference that if you're an expat anywhere in India and you need a procedure, the Arete Hospital would be an excellent choice for a local flight to come here and get an opinion. Or if you're an American or a European and you're looking at a procedure that in America or Europe is excessively costly, maybe a vacation to India combined with a procedure might be worth the effort.
If you or your loved ones are suffering from any spine disorders, it is advisable to seek a neurosurgeon's or a spine surgeon's advice and ask about minimal invasive techniques.
Everything about the hospital is new. Everything about the hospital is, as the structure, is US or European standard. I'm really quite impressed. Cut right to the most important thing is for me to give you the best possible recommendation I can give you, because my care here has been exceptional in all regards.
We wish him all the best and we are happy for his recovery.